when this 3-year extension is over, there are going to be a whole bunch of people who have been getting their health care, their health insurance, access to the health insurance through the Affordable Care Act exchanges for 5 years. So the 5 years they will have had access to health insurance. Does it make sense to make these permanent?
Well, again, if I put my politician hat on, it certainly is not good when you're the president or in the majority party of Congress and all of a sudden 5 million people lose their health insurance or have to have huge spikes in the amount that they have to pay for health insurance. That's pretty unpopular. So as with all things, it's about trade-offs. If we want to make these provisions permanent and we want to prevent that premium spike, we should be willing to pay for it by reducing costs elsewhere. And I spend a lot of time as the director of health policy of the Committee for a Responsible Federal Budget, thinking of ways to reduce the cost of healthcare. And there are plenty of things we could do to offset the cost of this expansion.
You got some ideas you want to share?
I have a lot of ideas. Maybe in the next segment, I'll talk you through Medicare Advantage because we could save a lot of money in Medicare Advantage, and I can talk about that in a little bit. But there are other kind of littler things we can do, especially for the Affordable Care Act. I don't want to get into the details, but there are things we do with cost sharing reductions that have kind of developed over time that make Affordable Care Act expansion more expensive, and we could reverse those, still cover people and not have the premium spikes that we're seeing. But I mean, this is one of those things that if you want to insure more people and that insurance is costly, we just need to find ways to pay for it. So I think extending it makes sense from a political point of view and from a human point of view. But I think doing that on the backs of the deficit does not make sense, especially when we know so many places in healthcare where we could be reducing costs.
So one of the
go ahead, Tori.
I was gonna say, one of the reasons they extended the Affordable Care Act subsidies is because we're still operating under a public health emergency here in the United States related to COVID. You know, when COVID hit, President Trump declared a public health emergency. And there are other features that are affected by that declaration. And I was just reading an article just before we hopped on the show that HHS announced in early August that they were going to extend that public health emergency again. And that by doing so, extending that public health emergency, it affects a whole bunch of other things. Things like expanded Medicaid coverage, Medicare telehealth services for seniors, so they don't have to leave their homes to go see a doctor. There are higher payments to hospitals to cover all the extra costs associated with fighting COVID, et cetera. Do you have a good sense of what the cost of extending this public health emergency is? And do you have some thoughts about how long we should consider keeping this public health emergency in place?
I mean, in general, I think the public health emergency probably should have been ended already, but I understand why it wasn't. I think the main thing keeping the Biden administration from renewing this, the main reason why they keep renewing it is to avoid a huge change in Medicaid enrollment. These are the lowest income individuals throughout all the different states. And right now, they are maintaining their ability to get Medicaid because the public health emergency made it impossible or told states that they could not redetermine eligibility for Medicaid, even if people had income increases over the last 2 years that would now not make them eligible. So that's the most dramatic change that's going to happen when the public health emergency ends. I think it will probably end in January. That doesn't mean that the president will be declaring COVID over, or that no one will get vaccines or anything like that. It just means that the amount of money the federal government is spending to keep this public health emergency going makes no sense in the current environment. For instance, we are still increasing payments to states for Medicaid, and most state budgets are have huge surpluses right now because of all of this federal money that's being sent to states. that is translating actually into higher inflation in the economy, and we know we're trying to reduce inflation. So the first thing we need to do is cut off those subsidies for states. The next thing we do is to make sure there's an orderly transition. As Medicaid redetermination happens, about 50% of those people will be eligible for healthcare, either in Medicaid or in another program. And the states need to work hard to make sure that we're not just dramatically cutting people off of health insurance. They're going to have time to do that. I think the Department of Health and Human Services has produced guidelines, but state governments operate in their own way. Some of them have technical capacity to do these things smoothly, others don't. So it's really going to be kind of a hairy process, which is never good when you're trying to make sure the lowest income with the greatest need get their health insurance. Mm-hmm. So that's one thing to keep an eye on. And then the kind of one of my pet things to keep an eye on is the telehealth authorities that you mentioned. And we are very concerned about the unfettered use of telehealth over the long term, increasing healthcare costs and increasing healthcare utilization. And this is like kind of a one-time shot, I think, for Congress to set up some guard rules about how telehealth expansion should proceed over the long term when this public health emergency ends. And right now, you have different interest groups on the Hill trying to convince members of Congress to just allow telehealth for everything, have no guardrails, as we did during the public health emergency. And I think that would be a missed opportunity. Because as we know in healthcare, once one of these things gets started and people have the benefit, it's very difficult to put rules and take some of those benefits away over the long term. So I look at this as kind of like a one-time thing. We need to do it right at the first moment we can, or else the battle will be lost over the long term. So that's something we're working with members of Congress on quite a bit to try and at least have some way to constrain the growth of telehealth properly, so that there's not waste, fraud, and abuse, so that there's not overutilization, and so that we don't have misaligned payment incentives. And those are the things we're working on.